Bonjour à tous. Hello everyone. Welcome to today's press conference. Bienvenue à la conférence de presse d'aujourd'hui. Je passe la parole au ministre Jean-Yves Duclos.
Bonjour tout le monde. Good afternoon, everyone. Thank you for joining us on this call. I'm delighted to be in the wonderful company of Minister Anita Anand, who is Minister of Public Services and Procurement, Major-General Dany Fortin, who is the head of logistics at the National Operations Center, will also speak to us shortly, followed by Dr. Tam, who is the Chief Public Health Officer at the Public Health Agency, and Dr. Njoo, Howard Njoo, who is Deputy Chief Public Health Officer at Canada's Public Health Agency. Before I turn to my colleague, Minister Anand, let me summarize briefly what the Prime Minister said this morning. First, that there is light at the end of the tunnel. We are obviously focused very much on the short-term epidemic and the crisis. We obviously also want to keep in mind that there will be an end in this tunnel, and that spring will come and better conditions for everyone will occur, and that will happen more quickly if we continue to look after each other, follow closely the public health advice, and not to travel. Le Premier ministre a été très clair tout à l'heure. Les consignes ont toujours été les mêmes, d'éviter les déplacements non essentiels et certainement ceux à l'étranger pour faire en sorte de prendre bien soin de sa santé et de protéger aussi la santé de ceux qui nous sont proches. On vaccination, Major General Fortin will have further information to share with us. However, the key objective is the same, is to vaccinate every Canadian that wants to be vaccinated by September. Our medium-term objective also remains the same, to have Canadians being delivered 6 million vaccines by the end of March, and that being done in the most rapid and the most efficient manner, but also in full collaboration with provinces and territories that have the important and challenging and difficult work to administer the doses in Canadians' arms. Et en terminant, le Premier ministre a aussi fait allusion à deux messages importants. Le premier, c'est le lien entre la santé des gens et la santé de l'économie. C'est ce qu'on a appris au cours de la pandémie, c'est ce qu'on va continuer à garder en tête, c'est qu'en prenant soin de la santé des gens, on va aussi prendre soin de la santé de l'économie. Et il a aussi fait allusion que lorsqu'on sera passé à travers de cette crise sanitaire, il y a une crise environnementale à laquelle nous allons continuer de devoir travailler pour faire en sorte que, comme on l'a toujours dit, la santé de l'environnement aille aussi avec la santé de l'économie. So with this being said, I would now be pleased to turn to my colleague Anita for her remarks.
Merci beaucoup, Jean-Yves, et bonjour tout le monde. Let me begin by thanking Canadians for following public health guidance to help slow the spread of the virus at this pivotal time. The sacrifices being made to protect families, friends, and fellow citizens are very difficult, but essential. En plus des vaccins qui seront essentiels pour vaincre la COVID-19, il faut continuer de suivre au conseil de Dr. Tam et Njoo. From the very beginning, our government pursued a diversified vaccine procurement approach. Given global demand for products emanating from a limited number of suppliers, we knew that we would likely need to weather challenges with supply, given complex manufacturing, unprecedented global demand, and rapid acceleration to peak production. We clearly saw this last week with news from Pfizer of temporary disruption delays. This was very disappointing, and I spent the weekend on the phone with Pfizer executives and my team. We reiterated firmly the importance for Canada to return to our regular delivery schedule as soon as possible. Pfizer assured us that it is deploying all efforts to do just that. This is an evolving situation, but I will continue to update Canadians as soon as I have additional information. This is the reason that I'm here today and that I will return to continue to update Canadians. Il est important de se rappeler cependant qu'il s'agit d'un retard temporaire. Le Canada recevra la totalité des doses qui lui sont dues ce trimestre. Bien que cette nouvelle puisse être considérée comme une reverse, je tiens à rappeler aux Canadiens où nous en sommes. In addition to Pfizer, we continue to receive steady deliveries of Moderna doses. Those deliveries remain on track. By the end of March, we too, as a country, will remain on track. We expect to have 6 million doses of Moderna and Pfizer in Canada and 80 million doses by the end of the year, the vast majority of which will be delivered before the end of September. And we have agreements in place for 5 additional vaccine candidates, which we will bring to Canada as soon as possible once they receive regulatory approval. Let me be very clear in terms of assuring Canadians. We will have enough vaccines in Canada for everyone who wishes to be vaccinated prior to the end of September 2021. Over the coming months, especially into the spring, Canadians, including the provinces and territories, will begin to see a dramatic increase in vaccine deliveries. Au cours des prochains mois, surtout au printemps, les Canadiens commenceront à voir une augmentation spectaculaire des vaccins livrés. It is possible that we will see additional supply challenges along the way. And again, this is precisely why we have multiple agreements in place with multiple manufacturers. The road forward may not be as straight and smooth as we would like, but we will together cross the finish line. By working together, we will succeed. We will overcome COVID-19 and get through this together. Thank you so much. Magwech. Merci beaucoup.
Merci beaucoup, Anita. Major-General Fortin?
Major-Général Fortin, votre caméra et votre son sont désactivés.
Désolé, ça devait arriver une fois, ça m'est arrivé à moi. Alors, bonjour, mesdames et messieurs. Alors, j'aimerais parler de Pfizer, de réduction Pfizer, et puis dire quelques mots sur Moderna. Alors, premièrement, sur la réduction de Pfizer, j'aimerais commencer par vous remercier pour votre flexibilité et compréhension, alors que nous travaillons sur les fluctuations des allocations de Pfizer au cours des prochaines semaines, tel qu'a été annoncé vendredi et comme réitéré d'ailleurs par la ministre. En général, nous anticipons une réduction assez importante des doses de Pfizer pour les 3 prochaines semaines, avec un retour à la normale par la suite. Il y aura un impact considérable dans toutes les provinces, bien entendu. L'impact global au cours du mois prochain est de l'ordre d'une diminution de 50% des allocations prévues, mais cet impact se fera sentir différemment d'une semaine à l'autre. Par exemple, cette semaine, alors que notre livraison était sur le point de quitter le site du manufacturier en Europe, nous recevrons 82% de notre allocation cette semaine. Et c'est en voie d'être réalisé d'ici le milieu de la semaine. Cependant, les livraisons de la semaine prochaine sont affectées et seront différées par Pfizer dans leur intégralité. Pour clarifier, nous avons été informés par Pfizer ce matin qu'il n'y aura pas d'expédition du vaccin Pfizer au cours de la semaine du 25 janvier. Alors que les chiffres de Pfizer commenceront à se stabiliser davantage au cours des prochaines semaines, ça va rebondir en février. Les chiffres pour les 2 premières semaines de février sont toujours à être confirmés. Par contre, on nous assure que les allocations qu'on va recevoir sont équitablement réparties entre les différents pays. Et nous espérons avoir une mise à jour de Pfizer cette semaine. Sur les livraisons, on prévoit recevoir au cours des 2 premières semaines de février. On sera en mesure de partager ça d'ici jeudi. Alors, on suit ça de très près. L'objectif de Pfizer, bien entendu, demeure de livrer 4 millions de doses d'ici la fin de ce trimestre, d'ici le 31 mars. Maintenant, pour ce qui est de Moderna, on continue de planifier recevoir 230 000 doses la première semaine de février, une distribution au cours des jours qui suivent. Et comme mentionné précédemment, les livraisons de Moderna sont sur une base de 3 semaines. I'd like to start by thanking everyone for their flexibility and their patience as we work through the fluctuations of Pfizer allocations over the next several weeks. In general, we anticipate a significant decline in Pfizer supply over the next 3 weeks, followed by a ramping back up of supply. There will be considerable impact across all provinces, asymmetric across the board. The overall impact over the next month is in the range of 50% decrease of expected allocations. But this impact, as I said, will be asymmetric. This week, as our shipment was being prepared, there's minimal impact. And in fact, we're receiving 82% of what we had originally planned on receiving. And that's the distribution is currently on the way, and we expect to have this done by mid to end week. However, next week's deliveries have been deferred by Pfizer in their entirety. To clarify, we're informed by Pfizer this morning that that the Pfizer vaccine to Canada in the week of 25 January. It will start back up in the first 2 weeks of February to expected numbers, modified numbers as we shared last week. So about half of what we had originally expected. But those numbers remain to be confirmed by Pfizer Canada. In fact, we have regular conversations with them, and we hope and we expect to have clarity on those numbers in time for Thursday with regards to the first and second week of February. Numbers are expected to go back up to what we had originally planned, and Pfizer continues to tell us that they expect to be able to deliver up to 4 million doses of Pfizer vaccine by the end of this quarter, so by the end of 31 March. A quick word on Moderna. Moderna is delivered on a 3-week cycle. We continue to plan on receiving 230,000 doses of Moderna product in the first week of February, and the follow-on shipments are unaffected at this time, and we'll continue to provide clarity on those numbers as we move forward. Merci beaucoup. Thank you very much.
Merci beaucoup, Major-General Fortin. Dr. Tam?
Bonjour à toutes et à tous. Welcome to our first virtual press conference. My colleagues and I in Ottawa are trying to do our part in reducing contacts as much as possible. So there have been over 715,000 cases of COVID-19 in Canada, including 18,120 deaths and nearly 74,000 active cases across the country. So nationally, the average case count is now close to 6,700 new cases being reported daily over the past week, with a still increasing number of people experiencing severe illness. There are an average of about 4,775 individuals with COVID-19 being treated in Canadian hospitals. Over 880 of them are in critical care, and over 140 deaths are being reported each day. Canada continues to monitor for virus variants of concern. To date, the National Microbiology Laboratory has verified 23 cases with a variant first reported in the United Kingdom, and 2 cases with the variant first reported in South Africa. By now, we have seen time and again that our actions matter, as we've watched COVID-19 trend up and down and up again. And we are reminded that our actions have consequences. Every time we get a little too tired or a little too excited about holidays or thinking that vaccines could give us a quick shortcut, we are met with a new spike of activity as COVID-19 tries to take the lead again. We have also come to realize that we're not all on equal footing and that some in our communities need additional support to be able to keep themselves and their loved ones safer. Last week's National Epidemiology and Modeling Update was the latest reality check. Of course, we're all tired and want this to be over and ultimately to win against this virus. But we are again at a pivotal moment where there is a great deal at stake. As cases accumulate ever more quickly, hospitalizations, critical illness, and deaths will continue to rise. It is incumbent upon all of us to prevent more of these tragic consequences. We're doubling our efforts and not letting up is the difficult work we need to do now. The consequences of these actions are the compound benefits we all want. By suppressing COVID-19 disease activity, we're all contributing to reducing the burden on the health system, supporting our healthcare workforce in the difficult task of planning and implementing mass vaccine rollout, and giving vaccines a longer runway to begin to work as access expands to reach all Canadians. For all we have been through and all we stand to achieve in the months ahead, we owe it to ourselves and all those we have worked to protect thus far to see this through and save every life we can. Every vacation travel we postpone for a better time in the future. Every outing or activity we avoid, shorten, or limit to essentials. All the diligence we apply to hand washing, masking, and spacing helps to reduce spread of the virus. This is the tough part of the COVID-19 marathon. Together, it will be easier. Thank you.
Bonjour à toutes et à tous. Il y a eu plus de 715 000 cas de COVID-19 au Canada, dont 18 120 décès et presque 74 000 cas actifs au pays. À l'échelle nationale, presque 6 700 nouveaux cas ont été signalés quotidiennement au cours de la dernière semaine. Le nombre de personnes gravement malades continue d'augmenter. En moyenne, plus de 4 775 personnes atteintes de la COVID-19 sont traitées dans les hôpitaux canadiens, dont près de 140 sont dans les unités de soins intensifs. De plus, 145 décès sont signalés chaque jour. Le Canada continue de surveiller l'apparition des variants préoccupants du virus. À ce jour, le Laboratoire national de microbiologie a confirmé 23 cas de variants détectés initialement au Royaume-Uni et 2 cas de variants détectés pour la première fois en Afrique du Sud. Nous avons pu jusqu'à maintenant constater à maintes reprises que nos actions comptent. En surveillant la courbe de la propagation de la COVID-19 qui grimpe et ralentit pour ensuite grimper de nouveau, cela nous rappelle les conséquences de nos actions. Chaque fois que nous en avons plus qu'assez, que nous nous excitons à l'approche des festivités que nous gardons ou que nous gardons trop d'espoir envers les vaccins comme solution pour accélérer le retour à la normale, nous connaissons une nouvelle augmentation de la transmission de la COVID-19. Nous savons aussi maintenant que nous ne sommes pas tous sur un même pied d'égalité face au virus et qu'un soutien additionnel est nécessaire pour que certaines personnes au sein de nos communautés puissent se protéger et protéger leurs proches. La mise à jour nationale de la semaine dernière sur l'épidémiologie et la modélisation a remis les pendules à l'heure. Nous en avons évidemment tous assez et désirons que tout revient à la normale et que nous gagnions la lutte contre ce virus. Nous en sommes cependant encore une fois à un moment crucial où l'enjeu est très important. Lorsque les cas se multiplient toujours plus rapidement, il en va de même pour les hospitalisations, les cas graves et les décès. Il nous revient à tous d'agir pour éviter que de telles conséquences tragiques ne surviennent à nouveau. Redoubler les efforts de ne pas baisser les bras, voilà les difficiles tâches que nous devons maintenant accomplir. C'est en agissant de façon concrète, concertée, que nous obtiendrons les avantages que nous recherchons tous. En ralentissant la propagation de la COVID-19, nous allégeons le fardeau du système de santé. Nous appuyons les travailleurs de la santé qui ont hérité de la tâche ardue de planifier et de mener des campagnes de vaccination de masse. Et nous accordons plus de temps pour que l'effort collectif, l'effet collectif des vaccins se concrétise grâce à leur distribution à l'ensemble des Canadiens. Compte tenu de tout ce que nous avons vécu, de tout ce que nous voulons accomplir au cours des prochains mois, nous avons le devoir envers nous-mêmes et tous ceux que nos efforts ont permis de protéger jusqu'à maintenant, de ne pas baisser les bras et de sauver toutes les vies possibles. Chaque voyage que nous remettons à plus tard, chaque activité ou sortie que nous évitons, écourtons ou limitons à l'essentiel, ainsi que les rigueurs avec lesquelles nous nous lavons les mains, portons un masque et respectons les principes de distanciation, contribuent à réduire la propagation du virus. Nous en sommes à la partie difficile de ce marathon contre la COVID-19. La surmonter ensemble sera plus facile. Merci.
Merci beaucoup, Dr. Njoo, et nous serions maintenant enchantés de répondre à vos questions.
Merci. Donc, nous allons commencer la période de questions. À titre de rappel, c'est une question de suivi chacun. We are now starting today's question period. Every reporter gets one question and one follow-up question. All questions today will be on the phone. Opérateur, c'est à vous.
Thank you. Merci. The first question is from, la première question est de Rachel Haynes from CTV. Please go ahead. À vous la parole.
Hi, everyone. Rachel Haynes here from CTV National News. I just want to go back to what we're talking about, how last week we were told that this was going to be equitable across all countries. However, now it seems that Canada is getting worse hit than European countries who have said over the weekend that they're now going to be getting their dosages and their vaccines restored next week. So what have the conversations been with Pfizer about this inequity that Canada seems to be experiencing, especially now as they're deferring the January 25th deliveries that we were supposed to be getting?
Before I turn to perhaps Anita.
Go ahead.
Before I turn to Anita and possibly to Major General Fortin, let us be all mindful that we've been very successful until now in having excellent relationships with both Pfizer and Moderna. And that's why we have been the second country in the Western world first to approve and then to administer after the UK the Pfizer vaccine. We have been the second country in the Western world first to approve and then to administer the Moderna vaccine after the US. So we've been demonstrating over the last few weeks that we are fully in touch and in great collaboration with the country that we're almost also very focused, and Minister Anand and Major General Fortin might want to reinforce that focus on the medium-term objective of securing our agreement with Pfizer, which is 4 million doses in the first quarter, that is between now and the end of March, with, as we've said earlier, the ultimate objective of vaccinating every Canadian that wants to be vaccinated by September. But Minister Anand might have something to add, perhaps to correct or to clarify, and the same thing for Major General Fortin.
Well, thanks, Jean-Yves, and thanks, Rachel, for the question. I want to, first of all, state that I spoke with Pfizer over the weekend. I insisted on equitable treatment in terms of global supply reductions that it had announced. And indeed, Pfizer assured me and Canada of equitable treatment. Canada remains on track to receive the 4 million doses that Pfizer previously committed to arrive before the end of March. And with the 2 million doses of Moderna, which are also on track, we remain on track to receive the 6 million doses as we have previously stated. The reduction is a temporary one, and Pfizer Canada has assured us that we will have our full allotment, and I believe that Europe will also receive its full allotment. In terms of the way in which Pfizer is ensuring that it meets its quarterly allotment commitments, those are questions that Pfizer needs to answer as opposed to me, because I don't have the answers regarding Pfizer's decisions. But we have been assured of equitable treatment, and we have been assured that we will receive the 4 million doses from Pfizer as previously promised. Thank you.
I can perhaps just compliment Ms. Anand's answer by saying that the discussions that we had all the way to this morning very much complement what Ms. Anand has had in terms of clarifications from Pfizer. The manufacturer has reiterated that they're applying this significant reduction across the board. Some countries have been impacted more severely this week. We have not, very lightly impacted. Our impact is more severe next week. We're expecting to receive some. We're now saying that our entire expected shipment is deferred for next week. And then the numbers will start to pick back up in the first weeks of February.
Follow-up question?
Yes, thank you. I understand about what you're saying, Major General, about some countries having been more impacted this week. However, some countries like Spain, we're seeing only about a 50% reduction this week, and then their delivery schedules, again, we're picking up the week following, whereas it seems that we're having a bit more of a reduction and no end or not as quick as an end to those reductions. But in terms of further reductions in supply, Minister Anand, you mentioned in your comments about it's possible that we're going to be seeing further supply issues. Has Pfizer made any guarantees that we won't be seeing any further reductions in their supply? Are there other options that Canada consider, like perhaps paying more for vaccines so that we don't continue to see any reductions?
Thank you so much. One of the positive moments in the conversation with Pfizer was indeed the assurance that we received that they remain on track to deliver the allotment for Canada that had been promised. And together with the Moderna shipment, we are on track for our Q1 deliveries. Having said that, in every conversation that I have with every supplier, I am reiterating the importance of earlier and earlier deliveries, including in Q1. And that will not change. Every conversation that I have, I will stress the urgency of the situation that Canada is in, and I will stress the importance of having doses in this country as soon as possible. Thank you.
Merci. Thank you. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque de la Presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous tous. Ma question, c'est pour Madame Anand. Corrigez-moi si je me trompe, mais vous ne dites plus qu'on recevra les quelques, je pense que c'est 1,2 ou 1,4 million de doses là, de Pfizer d'ici le mois de février. Vous incitez plutôt là, sur le fait qu'on va recevoir les 4 millions de doses d'ici le premier trimestre, donc d'ici la fin du mois de mars. Donc, est-ce que vous pensez que les chiffres seront revus à la baisse pour février en particulier?
I will begin responding and then I will hand it over to Major-General Dany Fortin. In the first instance, I think we have to remember that the shipments that we are receiving have been allocated to Canada and that chaque fournisseur essaie de rencontrer leurs obligations sur le contrat. Et ça, c'est très important pour les fournisseurs et pour nous aussi. Mais je ne vois pas à ce moment les autres interruptions avec le contrat, avec les livraisons, parce que nous avons déjà parlé avec Pfizer sur l'importance de rencontrent leurs obligations de nous. In other words, we, in our conversation, stress the importance of sticking to the new schedule once it is ascertained and ensuring that Canada receives the allotment of Pfizer doses that it has been promised. Mais comme j'ai dit déjà, c'est aussi important de renforcer chaque fois que nous parlons avec les fournisseurs, avec Pfizer, avec Moderna, que nous devons avoir les doses ici en Canada. Et ça, c'est la chose la plus importante pour moi. Et je dis ça chaque fois que je parle avec les fournisseurs. Et maintenant, je passe la parole à M. Dany Fortin.
Merci, Madame la ministre. Vous savez, depuis le début, depuis le 14 décembre, on a reçu ici, on a livré plus de 1 million de doses de vaccins entre Pfizer-BioNTech et Moderna. Et puis ça va continuer. Comme j'ai mentionné la semaine dernière, on a un obstacle. Et puis on va... le résultat de cet obstacle, c'est qu'on a la moitié des doses qu'on prévoyait recevoir sur une période de 4 semaines. Peu d'impact cette semaine, impact sévère la semaine prochaine, qui est plus sévère qu'on pensait initialement. Alors, regardons les semaines qui suivent. On va avoir une croissance en février et puis on s'attend toujours de recevoir d'ici la fin mars le 4 millions. Comment ça se représente concrètement au mois de février? Nécessairement, ce sera moins à première vue que ce qu'on anticipait à cause d'un débit qui va être moindre en début février. Mais on s'attend à ce que la croissance se matérialise en février, mi-février et plus. Alors, pour respecter leur engagement contractuel, nécessairement, ça va vouloir dire une augmentation considérable des livraisons hebdomadaires de la part de Pfizer-BioNTech au cours de la mi-février et jusqu'à fin mars. N'oubliez pas que par la suite, il y a une augmentation substantielle des 2 vaccins approuvés au cours d'avril. Alors, pendant que tout ça nous pose un défi réel, on est en train de se préparer à ce que va avoir l'air le 2e trimestre en termes de préparation, en termes d'augmentation significative de distribution à travers le pays.
OK. Donc, je comprends qu'à court terme, pour le mois de février, bref, on le sait pas encore. Là, on ne connaît pas encore le nombre de doses de Pfizer qu'on recevra. Et puis, mon autre question, c'est encore pour vous, Mme Anand. En fait, je voulais savoir est-ce que la décision de Québec de retarder la 2e dose jusqu'à 90 jours a compliqué les négociations, compliqué les choses un peu là, avec Pfizer? C'est une des raisons qui pourrait expliquer pourquoi peut-être on a plus de difficultés à obtenir des réponses et des engagements de leur part.
Merci pour la question. Non, pas du tout. Ça, c'est un concern que Pfizer a dit pendant nos négociations. Mais ça, ce n'est pas la raison pour les réductions, pas du tout. La seule raison est à cause de la réduction dans le pays, le Belgique, et ça, c'est la seule raison. Merci.
Merci. Thank you. We will take the next question. Opérateur.
Thank you. Merci. The next question is from. La prochaine question est de David Thurton from CBC News. Please go ahead. À vous la parole.
Hi, good morning, everyone. Just want to ask this question to Major-General Dany Fortin. You said provinces will be affected asymmetrically by the Pfizer reduction. Does that mean that some provinces will get a greater per capita share of the vaccines that do arrive? How do you decide who gets more, who gets less? Can you just break that down for us, please?
Thank you, David, for your question. When I mean asymmetric, it's due to the distribution per capita across the country that is done in multiples of trays of 975 doses. And you can only break it down so far. So provinces that were expected to receive 1 tray receive none. Those are receiving 2, if you cut, could receive 1, and so on and so forth. So the impact will be felt more in some jurisdictions due to the overall number being different from one province to the next. But we are very mindful of that impact. And in fact, there are some adjustments that are made to follow-on shipments to adjust as a result of last-minute cuts that were made at the manufacturer that saw little to no reduction in some provinces and more severe in others, and will adjust back up for a per capita distribution. So we're very mindful of that, and that per capita distribution remains our overarching principle.
Okay, thank you for that. And this is for Dr. Tam. It's a question about immunity. What percentage of immunity in the population would make it hard for the virus to find new hosts? I mean, and maybe you can give us an answer based on, immunizations that we've conducted in the past. Totally understand that, it's only been a couple months since we've had these new COVID-19 vaccines. So at what point might we expect to see the R number drop below 1? Can you provide your perspective on that, please?
Yes, thank you for the question. And obviously right now, the main focus is to provide the initial vaccines to the most vulnerable populations at high risk and frontline health providers, so long-term care facilities. So one, might expect that as I said before, in a month or two, one would hope to be able to see the individual impacts, but also the activity perhaps in the long-term care facility to begin to be reduced, but that's what we're watching out for initially. What we don't know at the moment, and I do think data will be available, but we don't know the vaccine effectiveness in reducing infection as opposed to reducing disease. So we do know that the vaccines they had amazing vaccine effectiveness against disease or symptomatic infection. We do not know if they the degree to which they may reduce infection or asymptomatic illness, in which asymptomatic infection, in which case there is a chance that people who are vaccinated could still transmit to others. That is the unknown. Overall, though, the vaccine coverage to achieve population protection or herd immunity is expected to be probably somewhere closer to 60-70%. Now, having said that, if you had virus variants that are more transmissible, you may actually have to have more vaccine coverage to achieve population immunity. So that's why we're conscious of the spread of these more transmissible variants.
Thank you. Merci. We will take the next question. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Hélène Bugetti de Le Devoir. Please go ahead. À vous la parole.
Yes, my question is for Minister Anand. I just would like to go back to this reduction of deliveries by Pfizer. Not so long ago, and bear with me, I don't recall exactly if it was a few days or a few weeks ago, Prime Minister Trudeau told provinces that it was not a good idea to keep in storage the second dose because we should not be afraid of delivery problems. And yet that's exactly what's happening now. So in light of this event with Pfizer, do you still think it's a good idea to administer all the doses provinces receive instead of keeping the second dose just in case?
Well, thank you for the question. I want to stress that I'm the Minister of Public Services and Procurement. So the recommendations relating to second doses are not one that are within my portfolio at all. I will turn the floor over to Dr. Tam, who's a doctor, to answer the question.
Yes, thank you for the question. So as at the outset, as we all know, this is going to be one of the most complex endeavors in public health history. And one of the reasons is, at least initially, these smaller amounts and the unpredictability of supply. Now, I think we need to anticipate the unexpected as people plan, provinces and territories plan the vaccine programs. So they need to take that into account. For sure, there had been some schedules that were provided to provinces by Major-General Dany Fortin on a very regular basis. But I think one does have to prepare for uncertainties in the days ahead, as we've just seen. And so I think it is up to the provinces and territories to plan for that. The National Advisory Committee on Immunization and the chief medical officers do support some flexibility in that dose interval given extraordinary circumstances, either based on epidemiology or based on the logistics and the vaccine supply. So that's how they will have to manage it. It's not easy, but that is part of the challenge as we implement. But I mean, mostly the decisions are in the hands of the province and territories.
Well, as a follow-up, Dr. Tam, with due respect, we have not answered a question. Is it a good idea then to inject all the doses and not keep the second dose? And as a follow-up, I noticed that today you're holding a virtual meeting after 10 months of the pandemic. So I'm just wondering, why did you wait so long before switching to virtual? And should the Prime Minister and other premiers throughout the country do the same and switch entirely to virtual?
So I think, the National Advisory Committee on Immunization have provided its recommendations and also the data that we know at this point. So the vaccine effectiveness, there is actually, quite promising signs that the first dose can provide protection to the population, but that you need a second dose for, the maximizing that immunity as well as duration of immunity. So I think we will also get more information with time on the effectiveness of that approach. Right now, the recommendation is to, you can flexibly look at that interval for up to 42 days. But if that interval is surpassed, that data needs to be collected so that we can further understand this. But partly the decision is based on the province's epidemiology, where they want to cover more people, even if the first dose coverage in terms of vaccine effectiveness is not as good. There is some reasonable vaccine effectiveness, and so it's a balance between the number of people being vaccinated with the first dose and then following up with a second dose when you have the vaccine. So I think that's what the provinces are trying to balance at the moment. But that initial vaccine effectiveness after the first dose, particularly 14 days after that first dose delivery, does show some very positive direction in terms of efficacy. But it's just that there's a lack of clinical data, so data must be collected. And I think for the virtual meeting, we have been observing physical distancing in a giant room, with desks further apart, masking and hand hygiene. All of that has been observed in our on-stage virtual briefing. But we are very fortunate to have our IT colleagues help us set things up so that we can, add another additional option and layer of protection, particularly as we are in Ottawa, we're in Ontario, where the province has increased their public health measures in terms of more stringent public health measures. So we're just doing our part in observing that. But up to now, we have been observing all the other public health measures in terms of physical distancing, hand hygiene, masking, and in a very big room. Thank you.
Thank you. Merci. We will take a final question. Nous allons prendre une dernière question. Opérateur.
Thank you. Merci. The next question is from, la prochaine question est de Abigail Bimam from Global News. Please go ahead. À vous la parole.
Thanks for taking my question. For both Dr. Tam and Minister Anand, on rapid tests, Canada's Testing Task Force's report highlights that rapid testing is one of 4 priorities, but it's been months since some of these rapid tests have been approved here. Why are we so behind at rolling them out?
So maybe I'll start and oh.
You know, maybe I'll start because I'll just talk about the procurement angle and then I'll hand it over to you. Is that okay, Theresa?
Yes, that's
So
great.
from
Thank
a
you.
procurement, thanks. So from a procurement perspective, let me just say that we have procured over 40.5 million rapid tests, and we have distributed a large number of those to the provinces and territories. Over 8 million, 14 million have gone to the provinces at the current time. And so our role as a federal government has been thus far to supplement testing regimes that the provinces currently have by procuring rapid tests. And we will continue to be supportive to the provinces in any way we can, not just with rapid tests, but of course with vaccine procurements and with covering the costs of those procurements as well as we have done. Dr. Tam, over to you.
Yes, thank you. So as Minister Anand has said, that over 14 million test kits have been distributed. Certainly at the Public Health Agency level, we've been working with the province and territories, chief medical officers, experts in providing guidance to support the application of a range of tests, including rapid tests, both the molecular tests and the antigen tests. And so part of our next stage, and I think it's great that the minister has struck this expert group to further support provinces and territories as they think about how to really step up on the application of those tests. So I think that was a very welcome report. And I have seen that there's many jurisdictions right now beginning to implement some of these tests, having validated the antigen test, for example, with the existing PCR testing. So I have, in my discussion and roundtables with provinces, seen that actually increase in the application of these tests. Where it has been extremely helpful has actually been in remote and isolated communities where these tests have played a key role. But also, I think now I think at long-term care facilities and other high-risk settings is some of the key places where I expect that province territories will be rolling them out. But yeah, so I think it is important as a very key pillar of our public health response is testing as part of contact tracing and isolation. So I think that right now, as everyone knows, we're experiencing resurgence in many areas of the country. Stringent public health measures are being applied during this period. And we want to see the peak of this epidemic, and we want to see it coming down sustainably. During that period of time is when we can scale up some of these measures to just add more layers of public health measures as before people start easing things up. It's important that capacity is put in place.
And a follow-up question specifically on seniors. We know that the elderly are more vulnerable to COVID. I'm wondering how you feel, Dr. Tam, that people who are over the age of 70 who don't live in long-term care homes are not part of the highest priority groups in some provinces.
I do know that they are priorities of the National Advisory Committee on Immunization. Again, indicated that seniors and those certainly living in congregate settings, whether they're long-term care or residences actually for seniors, that's another retirement communities where there's congregate living are key. But it's just a matter of getting the supply in order to do it. So In the community, one may expect to start with the oldest members of our society, and then going down to younger and younger age groups by 5-year increments is actually part of the plan. So I think it's just a matter of the implementation timeline with the doses available.
Thank you. Merci à tous. Ceci met fin à la conférence de presse d'aujourd'hui. This puts an end to today's press conference. Thank you, everyone.